Okay, we're continuing from Hidden History of Health by me, Pete Rogers. We're going to talk about epidemiology. Epidemiology is very valuable. It makes it obvious that certain things are true. The paleo, keto, carnivores are a bunch of lying scumbags, and they're going to tell you epidemiology doesn't matter, that it's not useful information. The reason they say that is because it proves that they are wrong. Okay, the arguments are so strong, it's unbelievable when you see this. Okay, so we're going to start out, for example. I'm just going to give you a couple examples that are helpful. This paper is from the Lancet journal, 1929. C.P. Donison is the author. It's called Blood Pressure in the African Native. All right, 1,800 consecutive admissions to the hospital. Here's Kenya and Africa, where they ate a primarily plant-based diet. 1,800 consecutive adult black men admitted to the hospital and their blood pressure was checked. What percentage would you guess were hypertensive? In the USA, it'd be like around 70%, 80%, something like that. Okay, in Kenya, it was 0%. Now, I realize most of you don't know anything about health, but I'm just telling you, these are extraordinary numbers. They're incredible numbers. Incredible. If you show this to a USA medical doctor, their eyes will bulge out of their head. Because to them, it's just, yeah, black people, you know, they get hypertension all the time. Most of them are hypertensive, nothing you could do, it's genetic and salt sensitive. BS. When they eat a plant-based diet, they have zero hypertension. All this genetic stuff is BS, okay? It's just a way to make people give up on trying to help themselves. Oh, it's genetic, there's nothing you can do. Oh, BS, it's not genetic. They don't have any hypertension when they eat a healthy diet. Blacks in the United States tend to eat a crappy diet. They tend to eat way too much processed food, which is full of sodium, and it's deficient in fiber, it's deficient in magnesium, it's deficient in potassium, it's deficient in precursor nitrates, okay? All right, so there's also another study, 1959, I forget the journal it was in, but it was about autopsies of adults in Africa, in Uganda, 1,429 of them. And what percentage died of a heart attack? The answer was 0. 0 died of a heart attack. In USA, that'd be like, 30%, 35%. So what I'm trying to tell you is, it doesn't get any better than this in healthcare research. 100 to 0, okay? Most people in a Western world are hypertensive in late middle age and older years, versus in Kenya, none of them are when they were eating a plant-based diet. None of them died of heart attack. It's the most common cause of death in the West. Death in the West, okay? And the average 60-year-old had a blood pressure of like 110 over 70, 105 over 70. All right, let's see. And they still teach in the medical school that nobody knows what causes high blood pressure, which is ridiculous. We've known for a long time, anybody that reads the literature, is that high blood pressure is caused by high-fat diets, it's caused by high-sodium diets, it's caused by diets deficient in plants, because the plant's got the magnesium, the potassium, and the plant nitrate precursors. It's also caused by excessive psychological stress, sleep deprivation, and caffeine. Okay. Richard Moore, MD, PhD, he wrote that book, great book called The High Blood Pressure Solution. He says the reason blacks are so hypertensive, like I said, because they eat processed food, which is full of sodium and it's deficient in potassium. Pretty obvious. And millions of people die every year because they don't know this. Here's his book, and it's a very good book, High Blood Pressure Solution by Richard Moore. It goes through all the ion pump stuff. Okay. Our ancestors probably ate 20 times as much as potassium and sodium, whereas modern Americans tend to eat about 10 times more sodium than potassium. Dennis Burkett said we're the only animal that eats more sodium than potassium. That's a disaster. Okay. Dr. McDougall felt that the excess dietary fat was a much bigger problem than the excess dietary sodium. When you eat the plants, whole plant food, you automatically drive up your potassium intake and drive down your sodium intake. McDougall does point out that the Japanese, let's say in the 1960s, ate a lot of sodium, but they were still reasonably healthy. But they did have a lot of hypertension. But because they didn't have all the high-fat diets, they were not as sick as you'd expect for somebody who ate that much sodium in the West. And they also ate a lot of vegetables. The Okinawans were healthier than the mainline Chinese because they ate less sodium. Okay, another study, this one came out of Kenya on breast cancer. Women in the United States had 20 times more breast cancer. And black women with breast cancer, they're more likely to die than white women with breast cancer. But in Kenya, 20 times less breast cancer, okay? You know, this diet and lifestyle stuff's a big deal. It comes from the, let's see what journal, the East African Medical Journal, 1991. Bajiragard is the author's name. So anyways, I'll leave that as part one of epidemiology, but this data is really strong data. I mean, what more do you want? It doesn't get any better than this. And if you don't get this, I'm sorry, you're stupid, okay? This is as good as it gets for data. You know, that in these countries, no one gets the disease. Nobody, not a single person. What more could you want than that?